So, I'm very excited to announce our final panel of Washington Weekend. Very exciting. Maybe we can give ourselves a round of applause that we've made it to this point. So this is our second global health panel of this weekend, featuring 5 more fantastic projects from our 2023 reporting fellows. In this panel, we're going to be hearing from Allison Delgado from Forsyth Technical Community College, Barbara Espinosa Barrera from the Boston University School of Public Health, Jacob Boyko from South Dakota State University, Precious Williams from the George Washington Milken Institute School of Public Health, and Blessed Sharif from Johns Hopkins University Bloomberg School of Public Health. So with that being said, Allison, I'll hand it over to you.
Hi everyone, I'm Allison, and over the summer I reported from Lima, Peru on my project. So here I have it titled Rutas de Provincia al Centro. Translated, this can mean routes from the provincial areas to the center, which is what I wanted to focus on in my presentation. To start off and give a bit of more background on this, I want to say that I am going to discuss the access of healthcare for Indigenous people in Peru, specifically in Lima, and how that compares to the other regions. But I do want to say that my project focused on the Quechua people, and that there are many Indigenous groups in Peru, like the Aymara and the Ashanaki people, that are different and also have their own challenges, but will not be covered in this presentation. So first, here's a map of Peru. As you can see, there's Lima in the orange region to the left, and bordered by is Ancash, Huancavelica, and Huancayo and Junin. In these regions, the majority of people speak Quechua, or it's a language that's more prominent. There are a lot of different ways that people travel from these regions to the center. One of them includes a bus, which can take as many as 12 hours. When I was interviewing people on how they identified after moving to Lima, a lot of them said they were Serrana or Provinciana. So even though they had lived in Lima for many years, they still identified strongly with their background from these first regions. Now, in discussing healthcare, which was the initial approach I had, I wanted to explore how people were able to access it through affordability, and I found that I couldn't talk about healthcare without talking about economic mobility and what that looked like for people. A lot of people in these provinces are used to being their own boss. They grow their own produce and then they sell them. This entrepreneurship continues. One place that I went to was the Mercado de Pueblo, and this was in Los Olvidos. So entrepreneurship, I think in the United States, carries a different connotation than it does here. This is one example of a market and the products that they can sell. So, and an overview of the healthcare sector before going into one of the more personal narratives I found. So there's public and private healthcare also in Peru, like in here. There are 3 different levels, level 1, level 2, and level 3. Level 3 has the most equipment and the most, usually people who are trained with specializations. For people who are going into the public healthcare sector, they are required to complete a serum, which is basically around a year of experience in an under-resourced area. That can be in the jungle or that could be in the highlands. Okay, and then to the story. Ciudad de los Reyes is also the name for the capital of Lima. This area has a lot of businesses. It's where children go to get their book bags and people go to get produce or any little materials they need. So this woman is named Margarita Villa Huancanamarca. She moved from Huancavelica to Lima when she was just 12 years old. Now she's 48 and she owns her own business where she sells book bags. Initially, when she came, she worked as a saleswoman, balancing all of her responsibilities, education, her job, and especially helping her mother access healthcare. Her mother, though she understood Spanish, was not fluent and could not speak it herself, so she constantly had to translate for her. From her experience, she spoke on the many challenges that came with this. In Lima, one of the comparisons between there and then Huancavelica and other regions is that Huancavelica mostly has postas, or centers that are less resourced rather than comparison to hospitals. These don't generally have people who are trained as specialists, and it is rare to find nurses or people who are specialized in a specific training there. For the most part, they are technicians, and this has a severe impact on the quality of healthcare that they can receive, because they don't generally interact with people who are experienced in giving diagnosis, only people who can recommend from their experience what would be the best route for them to take. There are also no ambulances, and the road isn't paved, so this creates another problem of how do people get access to this healthcare when they can't be transported. As a result, people walk from anywhere between 2 to 4 hours just to get to the nearest healthcare center. And this would be for issues from a cut to something more serious. Within Lima, she found that the issue of language changed. In Huancavelica, it's easier to find a healthcare professional who does speak Quechua, because that's where the majority of people have as their first language. However, in Lima, it is harder to find, and you have to have someone who can help you translate. That was the majority of her responsibility here. So, sorry. For her and her mother, she had to ensure that she would be respected within the patient room. Often doctors have difficulty listening to patient needs when they can't understand what they're saying. And something I learned from this, and something I heard from her, was that she found that regional governments need to pay more attention to these issues, especially when it results in patients not being heard. And then, why should people care? I think this is an issue that can reach across a lot of different populations, especially as healthcare inequity is an issue that is not just limited to these people. What she told me was, Medio Lima es inmigrante provincia. While this isn't an exact statistic, that 50% of people in Lima are from these regions, it does reflect a very strong idea and a very strong sentiment. That people here, that Lima is an area with a very big population of these people, and that their issues significantly matter. Yes. Thank you all for listening.
Hi, friends. My name is Barrera Espinosa Barrera, and I'm here representing the Boston University School of Public Health. So I'm so excited to tell you about this project, not because it's a cool project, but it's because it's also a project that is very near and dear to my heart. It is a story that is currently happening in the town that I grew up in, and a threat that is the reason why I was forced to leave the town that I grew up in. And the threat is this volcano that you see in the picture. The name of my project is Containing Our Backyard Volcano, and it is about Cotopaxi, the name of this volcano, and Latacunga, a town. So to put it in perspective, this is a map of the area. The top circle is Cotopaxi, the bottom circle is Latacunga. Cotopaxi is one of the tallest active volcanoes in the world, and it is located in the highlands of Ecuador, about 2 hours south of Quito. And Latacunga, it's about 1 hour south of the volcano. So it is very, very close. And because of this closeness, Latacunga has kind of claimed Cotopaxi as its own. There's a very strong sense of belonging among Latacunga people. And throughout history, in the last 150 years, people in Latacunga have had this very strong connection to the volcano, thinking of it as a protector, as a playground, as a place where fresh water comes from. But in 2015, our relationship with the volcano changed when it began its eruptive phase. So in 2015, it erupted for the first time, and it was nothing more than a loud noise. But because of unpreparedness and panic, 7 people died. Since then, Cotopaxi has continued to erupt, mostly like very mild eruptions that have thankfully caused no harm and no destruction to the city. But we know from looking at historical records at a geological research that there's a big one coming, and that when this one comes, it'll be highly destructive and it'll be very, very harmful, especially for cities that are riverside. For these cities, like Latacunga, the main concern are lahars. So this is a lahar, if you see the picture in the back. The big river of mud that you see coming from the crater of this volcano. This is a picture from Mount St. Helens in 1982 of an eruption. And the mud, the big river, the black river that you see coming from the crater, that's a lahar. This occur when the hot gases and lava that are coming from the volcano melt the glaciers and snow, and it forms into a giant river of mud and rocks and lava and toxic chemicals. And this can be very harmful because of their massive, massive size, but also because they flow paths of rivers and arrive to riverside cities very, very fast. So to put it in context, Latacunga has about 30 minutes since Cotopaxi explodes, and by then, the lahar will have arrived to the city. And it's not that Latacunga is at risk, but Latacunga is at a very high risk. So again, I am showing you a map, and the top circle, again, is Cotopaxi, and the bottom circle is Latacunga. And I know that it's a little hard to see, but those branches that you see coming from the top circle, those are rivers. And as you see, there are 3 rivers that converge into one right before Latacunga. So this places Latacunga at a uniquely high risk. And I'm telling you that the eruption is coming and it is imminent, but a group of activists are arguing that the destruction of Latacunga does not have to be. They are the main characters in my story. So this group of activists is comprised of academics, political leaders, local leaders, community members, and they have science on their side. They argue that by building these structures that you see on the 2 pictures on the screen, that are simplistic in nature, they are able to stop the flow, divert, or even slow down the flow of lahars, giving people in Latacunga the chance to even stay or to even evacuate in the case of an eruption. So far, their efforts have not been successful. The Ecuador national government has failed to respond and has been very, very slow in responding. But they have science on their side. They have academics arguing that this is a feasible solution for an imminent problem, and they are relentless. They have not stopped since 2015, and they have no plans in stopping now. They have worked across multiple administrations, multiple political parties, and they keep going at it, and that is my reporting plan, to report on their journey and to report on the feasibility of these structures. I also want to learn about the response of the community. Do they want this to happen? Do they think this is likely to save the city? Or is it just like a far-fetched dream? And as I prepare for this reporting project that is happening in January, I'm traveling to Ecuador in January, I have found that doing a reporting project in the place that I grew up in, it is both a blessing and a curse. A blessing because I know the city, I know the people. People are saying yes to my interviews. People know me, people already trust me, and that's been really, really great. But on the other side, I found that reporting on something that I love, reporting on a place that I love has been very, very challenging. But I will report on whatever the story takes me, and I'm excited to see where this story goes. Thank you, everyone.
All right. I'm Jacob Boyko. I'm from South Dakota State University, and my presentation is about the toxic river of Buenos Aires, Argentina. So what turned me on to this initially was just a random family vacation to Buenos Aires last December. My family just happened to be there coincidentally when Argentina won the World Cup. And what really struck me about this was traveling through the nation's capital from the outskirts into the center where the touristy areas are. You pass through like a lot of slum areas, a lot of like informal settlements, and what really struck me about that was the patriotism. Everybody's out celebrating. It was like a very happy moment. And I kind of wanted to learn more about these areas, so I started looking at maps, and what I noticed was these areas are all situated along this river, Riachuelo de la Matanza. So this river, it translates to Slaughter River, and if you go there, you'll know why. So this is kind of the shantytown area, and you can see the water in that picture. It's very muddy, very polluted, and the places located along this, they're called villas, or misery villages, and it's very densely populated, and a lot of the people in these areas, there's a reason that they're all there, and that's because it's areas that nobody else really wants to settle anymore, because the land and the river and the land around it have been abused by corporations and industry for hundreds of years. So heavy metals, raw sewage, and animal effluents, even today, it's very prominent. And as a result, the river is unusable, and people living around this river suffer very serious health conditions. So in response, the Argentine government, the Supreme Court ordered that the government needs to make a cleanup effort, and the result was this organization called ACUMAR. So far, the agency has removed tens of tons of trash, most of the abandoned cars and ships that industries just kind of threw into the river because it was essentially a citywide garbage can. So in the last 15 years, they've started this garbage sifting program, and they're cleaning up all the trash along the banks, and there is improvement. So the locals I talked to, I think I'm missing a slide. Darn. Hold on. Okay, well, that's unfortunate, but I had a cool picture in here of some locals I talked to, and one of them, he is in a rowing club on this river. So even with how bad the situation is, there is like hope, and they kind of try to carry on with life as best that they can. What he told me was that the improvement is noticeable. Garbage islands and oil splotches that used to just float by the river, and he said that so casually, like it was nothing, just giant garbage islands. He said those are less and less common now. The locals, they walked me around this village, and they took me along the river. They showed me all of the trash and the old rusted metal that was left from the factories, and they took me to this patch of dirt, and they explained to me that it was a community garden, and this is where they grew a lot of their food because a lot of people are unemployed. But the government made them take it out because the soil was just so bad, and there was lead, heavy metals, and the food was not safe to eat. In the last 3 years, they now have water and sewage, but before that, if they needed water, they couldn't use the river. They had to go into town and haul it back. So just a very difficult lifestyle. And yeah, I'm missing my slides, but so that's just part of it, though. The agency can clean up pretty much all of the garbage it wants, but there are other larger issues that are harder to address, and that is the health crisis. So the agency ACUMAR, they go door to door and they conduct health evaluations. So in one of the quarterly reports from this year, they went to 6,700 homes. They found high levels of lead in 292 people, and 90 of them were children under 6 years old. And that's not even getting into the tumors, the skin conditions, heart and lung disease, miscarriages. So it's a very difficult problem to kind of pinpoint because the solution isn't that easy. And one neighborhood representative I talked to, she kind of called out the government. She said that on paper we're a priority, but the transformations we expect are not taking place. Funds are going missing and are taken somewhere else. There are a lot of kids with lead in their blood, a lot of babies and kids hospitalized with pneumonia because of the level of moisture in the air. The problems haven't been resolved. The government of Buenos Aires is not taking care of this as they should be. And the government response was that they too have a funding problem. The city and the province of Buenos Aires, they're not providing the support that they need. But with all of this, it's kind of a muddy situation, but there is hope. A new water treatment plant is scheduled to be completed this year, and that is a very good thing because 70% of the sewage in the river is water. It is sewage, and it's human sewage because a lot of the informal settlements, they reroute their sewage into storm drains and it just flows into the river. Or the slaughterhouses along the river, they dump the waste in there. So this water treatment plant will get rid of 70% of that, but nobody, not even the government, says that it's going to be an immediate change. Everyone's very realistic about it. And they say it's going to be generations before all of the sewage is out. But, it's a little beacon of hope, and everyone was kind of very hopeful about what this would mean for the future. The government agency I talked to, the guy from there, he told me that in a few decades, they hope people can swim and fish in the river again.
Hi, everyone. My name is Precious Williams, and I am from the Milken Institute School of Public Health, George Washington University. A little bit of background about my story. I was checking a lot of diseases because I studied global health epidemiology and disease control at GW. And I realized that for malaria incidents in Nigeria, there is a plan in 2022 that the president established to eradicate malaria and said we would phase out malaria by 2030, and that's about 7 years from now. And then I started to think, we're gonna eradicate malaria. That's cool. What's your plan? And according to the plan, there's a strategy for vaccine introduction, which, if you don't know Africans, we do not do that unless it's very compulsory. And then there are other different strategies like using of mosquito-treated nets. And I wondered, what about vector control? What is your plan for vector control? And there was none. And which was interesting because malaria is from mosquitoes. Mosquitoes breed in water. If you don't control the drainage system, how are you going to fix the problem? So that's why I was interested in this, and my topic says the drainage system that stands in the way, seeking disease eradication in Lagos, Nigeria. If you look at these children, this is about 1 minute from where I live, and where my parents currently live, and this was on my last day of my project. I was stuck at home, and I had nowhere to take my luggage to, and my street was flooded. A little bit about Lagos. Lagos, Nigeria, most of you know us for our Afro-pop, and we have really good food, even if it's not the best food in the country, but whatever. It's a very it's the smallest city in Nigeria, and yet it's the most populous city in the country. It is where everything happens. However, in a very big mega city, imagine New York, a third of the populace, which is an underestimation in my opinion, is at the risk of flood. And this flooding is a consequence of the poor drainage system in the country. If you look over there, that's my junior brother, actually. He was looking and I was like, there's no hope today. If you look at the area, basically, the drainage system works in a way that we have an interconnection of like shallow canals in different streets, and these shallow canals lead to, these shallow gutters lead to a small canal in the main roads, and those interconnect to a wide canal to kind of like control how the water moves. However, it's poorly maintained, if not maintained at all, and that's typically how it looks. And this was taken in Ikeja, which is the state capital, and the other was also taken in a very fairly rich aspect in like a small community also. So my main focus for this project was to actually show pictures, because I was like, people need to see that this is a problem. Like, we can't keep living like this. And also I wanted to like hear stories from the residents. I wanted to speak to professionals and also researchers in the field. So I conducted interviews, visited multiple sites. I think every day I was in a new local government. It was fun, not really, not if you know Lagos traffic. And I had like the residents I spoke to lead me on like tours around their area. So if they see me taking pictures of themselves, no one come and ask me for money, because they're like, oh, I know this person, they live there. So that was my strategy for this project. And I can say the findings could be divided into two: the cause and the way forward, basically. So basically, Lagos has a poor disposal system. If you see like the pictures, they're first of all like very poor waste management. The influx and the high population in Lagos did not consider how to manage waste. So what you see is people dump waste in their neighbors' backyard sometimes and on the streets, and there's no way to pack that. And also, most houses do not have gutter systems. It's very unfortunate, but most houses do not actually have a pathway for water to flow. If you see the houses, you can see like the fence areas. There are supposed to be gutters there, but there isn't any one. And also, the last clutch waste pathways is where the canal is supposed to be. There is, first of all, a very close proximity of houses to the canals, which is very ridiculous. It's not supposed to be so. And also there is clogged waste in the canals also. So because of the houses and the proximity of the houses to the canals, people turn that to like a waste system and dump their waste into it. And this is the effect. So the effect is you have the houses very close to the canals, and their water system is actually very close, which is not healthy at all. And also we have injury, breeding sites for disease, and people having like poor living conditions. And this is the reality of people who live in Lagos. I followed the story of a lot of my friends and acquaintances that I contacted, and Halima, who lives in Satellite Town. If you know Satellite Town, it's like where the army and the police stay, and that's like supposed to be like a safe haven for her. However, it's like as much as there is safety security-wise, there is no safety road-wise. On her way to work, she was on the bike, and she fell into the water and had to literally pack her things and go to a hospital to fix her broken leg. And sometimes she still walks with a limp. And then you have Uche in Oroshoki, whose houses, as you see, with the like church beside it, leading their own water waste into the street. He has mosquitoes all year round. There is no like, oh, it's just in the summer in the US where you have mosquitoes around. We have that all year round. And Chizaram said, and I quote exactly, Lagos is irredeemable, and there is a need to decongest Lagos, which leads me to the way forward. There is a need for urban planning regulation, an investment both in public health, and the government also has to treat public health as a priority. I interviewed my boss, my former boss, who is like a infectious disease professional in Lagos, and he said, if the government of Nigeria today says there is no longer malaria, there is no longer malaria. So they don't treat people as important, and they don't treat public health as a priority, which is very sad. Sorry, I'm supposed to stop apparently. And then citizens also have their responsibilities also. We have the voting power, we need to have the local government accountable, and then corporate bodies around those areas that you see, they are actually companies. There's GT Bank, there's Access Bank, who actually have places around. And it's very interesting how you have multi-million-dollar companies right there operating their businesses, and there is nothing being done about it. So that's the end.
All right, so good afternoon, everyone. I'm very excited to be sharing with you all the last story of Washington Weekend. My name is Blessed. I'm from Hopkins University, and the story that I want to share with you guys today is the story of mind over matter, or really the story of how a mental health movement is transforming the lives of patients in Sierra Leone. And for those of you that are a little unfamiliar, Sierra Leone is a small country in West Africa. It has about the same population as the city of New York. And it also has one of the largest mental health treatment gaps in the world. So 98% of folks that need mental health services in Sierra Leone will not receive it. There's lots of things that are driving this unmet need, and I want to share a few of those things with you just for context about this country and what it's been going through. So this country is emerging from a civil war, a very bloody, very traumatizing, and protracted civil war. Some of you may have seen it dramatized in movies like Blood Diamond and Beasts of No Nation. On top of that, this country is also dealing with the collective trauma of two pandemics within the last decade, both COVID-19 and Ebola. On top of that, the daily realities of poverty, the daily realities of climate change, which disproportionately affect low-income countries. These are some of the things that are driving mental health needs in the country. So in my pre-reporting research, I wanted to understand what's sort of being done to close this treatment gap. And I think this timeline represents for us just how long Sierra Leone has been involved in this process of promoting mental health in the country. In fact, Sierra Leone was the first country in the continent of Africa to own and operate its own psychiatric hospital. But up until 2016, there was only one psychiatrist in the entire country. So for a population of 8 million people, one psychiatrist. And since 2016, that ratio has dramatically shifted in the right direction, thanks to a new national mental health policy and thanks to new training programs to build workforce capacity. So new training programs for mental health nurses and psychologists, and what I think is maybe the crown jewel or crown achievement of the government in the last year has been the establishment of a psychiatry residency training program, the first psychiatry residency training program in the country, which is currently training 6 psychiatrists. So, in looking at all of the solutions that have been put forth by the government and by the people of Sierra Leone, I realized something, that we are literally watching a mental health system being built from scratch. And I wanted to know what kind of mental health system that was developing under that kind of pressure. And so my reporting process, if I can go through it briefly with you, was kind of a little bit circuitous. I came to the country in September, and I had an idea of the kind of people I wanted to talk to. I think the most obvious place to start, for me, I wanted to start with the Sierra Leone psychiatric hospital staff and understanding their environment and their experiences treating mental health patients. Unfortunately, I received a lot of pushback, so there was quite a bit of hesitation, which in hindsight actually made a lot of sense because these were the first doctors of their kind in the country, and they were experiencing a lot of stigma and backlash and were understandably nervous to talk to reporters. So I had to do a lot of relationship building. I had to do a lot of trust building. But meanwhile, while I was building those relationships, I had the opportunity to talk to other sources. So I was able to talk to the Sierra Leone Mental Health Coalition, which is a grassroots organization that had been fighting for years for mental health access and services in Sierra Leone. I also had the opportunity to learn from the perspective of patients what it was like to navigate the mental health system. And so when I eventually circled back after building those relationships at the psychiatric hospital and had the opportunity to actually interview the doctors there, I already had so many different perspectives to build off of. And I want to share with you some of those perspectives now. So from the patient perspective, I spoke to the family. I spoke to a 22-year-old patient and his family. And he was admitted to the hospital because he had an addiction to a drug that the locals call Kush. It's a synthetic cannabinoid that is mixed with toxic chemicals like embalming fluid and sometimes even bone shavings. And as I was speaking to this patient's mother pointed out to me how swollen his feet were. This is a sign of organ failure. And it's one of the signs of an advanced addiction in this patient population. And this mother was devastated, wondering how it was that her son had come to be this way. And so as I was speaking to her, sitting in this triage, speaking to the mother of this patient, I looked around and realized actually in horror that this triage was full of young male patients just like this. And in speaking to the providers a little bit later on, I understood from them that in the last year, 80% of the patients that are coming through the hospital are coming through the hospital with this problem, with addiction to this drug called Kush. And it was a drug epidemic that was facing a new and fragile mental health system and new and fragile doctors as well. But they were facing it with a lot of strength and a lot of courage. And they were optimistic about treatment options, that even though it was the 6 of them facing upwards of 100 patients a day, they were optimistic. I met a psychiatrist that never wanted to be a psychiatrist until she actually saw the work of her hands, until she actually saw the patients recovering. And she saw that, especially for these Kush patients, that they could reclaim their future as young men, and therefore they could also reclaim the future of the country. I think another important perspective, particularly from the Mental Health Coalition, that I gained was the perspective on treatment being incredibly important, but treatment being something that just scratches the surface of what is needed for a mental health movement, especially when systemic change is needed. And I learned from them the socio-political challenges that the country was facing in the context of the mental health movement. And I learned that while kind and resilient doctors are necessary and important, what is also necessary and important is a kind and resilient system. And so I'm just also want to sort of wrap up by sharing with you some of the lessons learned. I'm in the process of sort of writing the story out right now, but I wanted to share lessons learned from the reporting process. One, I mentioned before that the that my reporting process was quite circuitous, and I'm grateful for that because, again, it helped me to diversify my sources and enrich the story, especially because of those patient perspectives. I was able to my second point, really humanize the story, and I'm really grateful that things didn't go quite as planned when I first got to Sierra Leone. And the third point and last point that I'll leave you guys with is this idea of mind over matter, which I think sort of summarizes the mental health movement as I perceived it and experienced it in my time in Sierra Leone. And an important lesson, I think, for resource-constrained settings as well is that it's not just the material circumstances that push a mental health movement forward. It's also a mindset. The mindset that I observed in the physicians that would stay until 3 a.m. admitting new patients. It was the same mindset that I observed in volunteers at the Mental Health Coalition that were there as volunteers, unpaid, and to push this movement forward. And it was also the mindset of patients that would come to the hospital day after day, some of them not even having transport money to go back home, but they knew they needed to be at the hospital, and they trusted this space to make them better. So it's really a mindset of resilience and hope that helped build a mental health system from scratch. So that is all I have. Thank you all.
Thank you again so much, panelists. You all did an amazing job. I want to go ahead and start, as usual, with any questions that you might have for one another.
Hi, sorry. I have a question for Blessed, and I also have a question for Barbara. Thinking of like the mental health, I'm sure like the initiative by the government is backed up by data. I'm wondering if you found, or if there are currently any plans to kind of like guide people towards actually completing like a psychiatry program in the university to kind of like increase the amount of psychiatrists they have in the country. And then for Barbara, I'm interested in like knowing why the government and like most stakeholders that are not the residents, why they are interested in actually keeping those localities like very close to the volcano. That's very interesting. Is there like an economic benefit to keeping the localities like close to the volcano? Like, is there like an emergency plan that is like foolproof to why they wouldn't like move the people away?
Okay, so thank you for that question. It's actually a really important question in terms of, you know, how do you sustain a program like this? Most of the psychiatrists that I spoke to when I visited Sierra Leone didn't want to be psychiatrists. They didn't want to. They were horrified, actually, that they ended up in that position. And I think 2 reasons. One, there's still a lot of mental health stigma in the country. And then 2, lack of exposure. What I noticed about what a lot of them said was that their exposure to the psychiatry profession and the compassionate teamwork involved therein, and their exposure to patients and their treatment process and being able to watch them get better is what changed their mind about psychiatry. So in terms of strategy for, you know, ensuring that recruitment of psychiatrists can be sustained and that the residency program can keep going, one of the biggest things that I think we can praise them for is for enhancing students' exposure to psychiatry. In this first cohort of psychiatrists, none of them had ever taken a psychiatry course in medical school. Their first exposure was as residents. Now, the exposure is a lot different for medical students in that country. They are required to rotate on the psychiatry service and get exposure in that way. And so I think that's an important stepping stone for for enhancing recruitment of those psychiatrists.
So I guess the first part of your question is what is the economic benefit of having localities stay there even though they're endangered? Yeah, that's a great question. And I think it goes back to agency, I believe, and there may not be an economic benefit, but it's a city and it's people that have very strong connection to the land, and they may not want to leave, and they do, according to this group of activists, they have the opportunity to stay. This is the life-saving opportunity that they've been waiting for, and this is it, and because of this, they might be able to stay. And to answer the second part of the question as to why has the government of Ecuador not responded, based on my pre-reporting, it's looking like the government of Ecuador does not believe that this infrastructure will work, and that they think that it will give people in the cities a false sense of security, and that because of that, they will not evacuate in the case of an eruption. Yeah, so that is kind of where it's at right now.
Audience questions?
Hello, my name is Simeon Hardley from Southern Illinois University. My question is for Barbara. You mentioned when I think you said 2015, when it erupted, but it didn't fully erupt. It was 7 casualties. I was wondering if you can expand more on what happened exactly. And also, I'm interested to find out exactly, because you said they have a strong connection with the land and the volcano. If there's any spirituality connected to it, because you said they do believe that it's protecting them. And I was wondering if maybe that could be, because I feel like sometimes in history, there's always stories of people that, even though they are in danger, since they believe that they will never be harmed by what they believe is protecting them, that can be the thing that may prevent them from actually leaving when it does erupt. Thank you. Or if it does erupt, sorry.
So to answer the second part of your question, which, sorry, I'm trying to remember everything that you just asked me. That's okay. Okay, sorry, can you actually repeat it? Yeah.
The second question was the spirituality aspect to it and how
Okay.
they feel like it's a protector, even though science says that it can be endangering to them.
Yes, and I think it's because of their ancestry. People have been living in this land for hundreds of years, and for as long as their great-grandparents can remember, this volcano has been nothing more than a playground. It has been a gentle giant. People go there on weekends to spend a day, and there is a strong connection of spirituality. The indigenous people refer to this place as Taita Cotopaxi, which translates to Father Cotopaxi. So there is. It is kind of like a god in some indigenous communities, and I don't think I think it is very hard to say if people want to leave, because sometimes people just don't want to leave, and if there's an option, maybe that is the option worth pursuing. And sorry, what was the first part of your question? Oh yes, the 7 casualties. Yes, the Cotopaxi exploded and it made a really, really loud noise. And people started freaking out about the lahars coming down, and they knew that they had roughly 30 minutes to evacuate. So in this panic, trying to evacuate the city in under 30 minutes, people died because of mass hysteria and car accidents and trampling, and it was really, really tragic. And part of it was too that the local government failed to address that what was happening was not an actual state of emergency. It was just a loud noise, but the local radio failed to address that.
Joy from George Washington School of Public Health. First of all, amazing presentation to all of you. And my question is for Allison. So I was wondering if you can tell me if are the 3 levels of the healthcare system for both private and public, and is public affordable to everyone? And do people prefer private healthcare? Because in some countries private tends to appear to be better to the people. Thank you.
Yes, the 3 levels of healthcare are across both types. And for your second question, what was it again? Sorry. Yes. So for the public healthcare, one of the doctors I interviewed work at Salud. It was a center there, and their mission is to provide healthcare to all Peruvians regardless of how they can afford it, or regardless of if they can afford it. So with that, that's where they receive the state-sponsored healthcare, so they make it affordable for them. And then generally, people who can afford it would usually opt for private healthcare, but public healthcare in Peru is also, when I visited the center, they had a lot of patients. So in private healthcare, it can be faster to get an appointment. And not only that, but they generally are better resourced as well. So they're not exactly equal in terms of resource availability, but they are both capable of providing care.
Hi, y'all. Adam Goldstein. I'm from the University of Missouri. My question's for Jacob. It was great to hear a story about Buenos Aires. I lived there for 6 months, and I know that right now the state the country is really in an unprecedented inflation crisis. Costs of things keep going up year over year. I think I heard on the radio a few years ago it was around over 100%. And I'm just kind of curious as to, a couple of things. One, how is that affecting timeline and the conversations around the process of building this? Do they think it's going to get done on time? And secondly, I know there's a lot of just general kind of political conflict in Argentina between classes and, historical. And I'm kind of curious as to, how this conversation over this treatment plant is being heard in broader society outside of, these small villas miserias.
Right. Well, what surprised me was when I wasn't in the villas and I was talking to people about what I was doing, very few people had any idea what Acumar was, or even that there was like a problem with the river other than nobody goes there because it's gross. So, yeah, as far as that goes, like very, very few people knew about it. And another thing, like, with all of the political turmoil, like you said, and the inflation, even the people in the villas, the river isn't the biggest thing on their minds right now, as you can imagine. Like, even since I've left, the inflation has gone up another like 20, 30%. So, yeah, it's a whole bunch of issues there. And I'm sorry, what was the first part of your question?
No, just how is that affecting the timeline on the project? Do you know if it's slowing it down at all, or if they still expect to get it done on time?
It seems like they're going to have it done by next year around this time, but they've been working on this stuff for 15 years and there's kind of minimal progress, so I wouldn't be surprised if it takes a little longer.
Hi, Rajvi. I have a question for Blessed. I really like the way that you told your story, even just to us. I thought it was like really cool. I wanted to ask, you mentioned hesitancy from like people who didn't want to be psychiatrists and are here. And I'm wondering if there's any way to kind of understand a broader kind of reception or like understanding or even acceptance of mental health in like the broader community of people who could possibly be patients, because I feel like a lot of the times we are, like think about mental health and the first thing that comes to mind is stigma, right? Of like of a community of maybe traditional practices or just shut up and don't talk about your problems, whatever it is. And I think it's really cool that you like addiction was something that you found, because it's like a symptom of, as you said, sociopolitical, but I feel like that's like 3 layers deeper into diagnosing a problem. So I just wanted to understand if you had any plan of kind of giving a picture of how mental health is perceived in the broader community.
Yeah, so if I understand your question correctly, you're asking in the actual article that I'm going to write, how am I going to talk about how mental health is perceived by the broader community? Okay. Yeah, so I will share a personal experience, I think, that might give you a perspective on how mental health is viewed in the broader community. So when you're traveling around Sierra Leone, hardly anyone will know that you're talking about the Sierra Leone Psychiatric Hospital if you use its proper name, which is the Sierra Leone Psychiatric Hospital. It is almost universally known as Kisi Cresial, which is a local term meaning the crazy house in Kisi, which is where it is. And so the language itself, the local language itself, kind of tells you what they think about mental health patients and how they view mental health. The stigma that I mentioned comes not just from the general population, but also from within the profession itself. And I think it's important to draw out the stories of doctors that not only deal with, trying to educate their patients, trying to educate the larger community, but also having to do the work of educating their colleagues as well. And that's something that kind of came through a lot in my conversations with the psychiatrists I spoke to. And like I said, I'm still putting pen to paper right now and giving words to it, but I think that's sort of how I want to approach that, and that's sort of the general issues that I would want to draw out.
Hi, Lalani, American University. My question is for Precious. I know that you mentioned something about kind of Nigerians in general being, I don't know if they're wary of vaccines or it's just something they're not interested in taking. I was wondering if it has anything to do with, and there might not be a direct correlation, but I know that there's been like exploitation of populations who need medication, like medical experimentation by pharmaceutical companies and that kind of thing in delivering vaccines and medications. I was wondering if you know if it has anything to do with that or if it's just a cultural kind of phenomenon.
So I think you're referring to like the Pfizer Cano issue. Bit of background. Pfizer was doing, I think, a study on, was it polio? Yeah, it was polio vaccines, and that led to a bunch of Nigerian children dying. And then there was like a huge payout in 2014, but this took a long time to happen. The average Nigerian doesn't know that story. It's only people that are probably like in the healthcare sector that kind of like know it. And also that story is definitely very important for Kano and for the northern states. So in the northern states where we have probably like implementation of vaccines and stuff, that's probably where. There's most likely a vaccine culture for children. Nigeria, it's a cultural thing that you take your child to the hospital when you give birth to your child. You have to follow the vaccine schedule. But when it comes to adult vaccine, that means you want to make people take HPV vaccine. There's a huge pushback. No one would remember to take the 3 doses of a vaccine, and the malaria is like 3 right now, and it's not even that effective at 3. Even completing like the dose of like malaria, the dose of the malaria like drug, it's just like healthcare is not prioritized person-wise. We believe in God and God gives us health. And I was telling my mom in Nigeria that don't blame your leg problems on the evil people and the village people, that they're not your problem. God knows that. God gave you the body. You're supposed to take care of the body. You go to the hospital, do your healthcare checks. But it's kind of like, God gives us health. So our health is in the hands of God, which I'm a Christian and I do believe, but then I also believe God gave you wisdom. healthcare is available for a reason. So like it's just like the culture. It's more cultural than it is the Kano situation, which could be in the north, but not necessarily like in the western states.
Good afternoon. My name is Camille, and I go to Cutman Community College. My question is for Blessed. I just want to know, how does these mental institutions in Sierra Leone get funding? And is this issue being publicized on other media outlets as well?
Yeah, so the funding of the Sierra Leone Psychiatric Hospital is a joint funding project by the Sierra Leone national government, Ministry of Health, under the directorate of the non-communicable diseases and mental health, which is brand new actually. And then the other funding source are Partners in Health, which is an international NGO that does this kind of work across many different countries. The other question you asked is about, now I can't read my own handwriting, I'm sorry. What was the other question?
Is this issue being publicized on other outlets, media outlets?
Oh, yes. So this is an issue that I first found out about because when the psychiatry residency program was first established, when they first got accredited, the story of the emergence of that program was published in the New York Times. So that's how I found out about it. And as far as why I chose to do this project, though, is because I felt like there was I couldn't find a follow-up. I couldn't find stories about, well, what's happening? You know, where is this program going? What is this program doing? What are their challenges now? So 1 year later, almost to the date, the program was founded last year in October, end of October, November. And now, almost a year to date, I felt like it was an appropriate time to circle back around and figure out, you know, what are the lessons we can learn from this program.
Oh, hi, everyone. Great presentation to you all. Congratulations once again. I do have two questions, one for Precious and the other for Blessing. I'll start with Precious. I just wanted to ask, with regards to the drainage issue, do you think there might be an issue with regards to who is meant to prioritize, you know, solving the issue? Is it meant to be like an intersectoral collaboration? Is it meant to be the Ministry of Health? Do you think that these organizations or these institutions also have problems identifying who is meant to do this? And for Blessing, thank you so much for the presentation as well. And my question is that during your research and reporting, do you find that there are initiatives or any form of, you know, a capacity to take, you know, the information about mental health to the people themselves in form of sensitization, advocacy? I know it's one thing, you know, that's primarily looking into access to mental health, not just necessarily in the psychiatric hospital, but I think there is a long way to demystify the, you know, stigma. And what is there any, you know, activity or anything done to extend their outreach? Thank you.
I'll go first. So yeah, that was like a very huge question that I had concerning whose problem Lagos drainage system is. And I spoke to a flood consultant who currently works for the World Bank, and this was like his entire life has been like flood research and the drainage system in Nigeria. And then he tried to, and I spoke to like other people also, and on the base law, if we go to the local law, or the Nigerian law, the Lagos law, the local government is powered with the authority to manage waste and the local drainage system in their specific regions, and also the state government manages the bigger picture, so the expressways, the major stateways. The healthcare system, not so much. I didn't see any paper on the Ministry of Health of Lagos doing anything concerning it. And also, so we have this is like a Nigerian thing, but we have like LASMA in Lagos. They kind of like manage the waste system. So they clean up the gutters, but they don't do it themselves. Now I heard that they actually have independent contractors that kind of like take the project and are supposed to do it, but they don't. And sometimes even if they do, they just like empty out the gutters. I have so many pictures of this. If you want to see that, on my phone. They empty out the gutters and leave it on the street. And then when it rains again, it washes back in. And we're like, what exactly is your point? Like, if you want to like take it out, you've taken it out, just take it away. But no, that's the bulk of the problem. And I think there is no intersectorial collaboration with managing healthcare. And I can list like several different reasons like why. A lot of the thing is that in Nigeria, in like the huge universities, University of Lagos, University of Abuja, University of Ibadan, you need to have an MD to do an MPH. So you need to be a doctor to do a master's in public health. And that makes no sense. Why do you need to be a doctor to do public health? So because of that, you have very little people who have a lot of knowledge in public health, because in Nigeria, doctors prioritize their getting money. The government doesn't really pay that much. Privatization pays a lot. So they move into that. Nobody really does public health because you would just meet like a roadblock and it's going to frustrate you. So there's like not a lot of collaboration between the environment and the Ministry of Health. Is both pushed to the Ministry of Environment, which is the LASMA, who hires people to take out the gutters and manage the waste, and those people don't do it, and there's nobody to kind of like control. And then also the landlords who are supposed to build the houses in urban planning, to have the gutters erected at their houses and also to manage the cleaning of that, don't necessarily get the permit to build their houses. They just build indiscriminately because nobody is watching. So it's kind of like a multi-sectoral problem, and then there's no collaboration.
So thank you for your question. It's a great question. How do you bring mental health to the people, right, outside of the hospital? I will tell you, yes, there are a lot of activities outside of the hospital that are being done to promote mental health awareness. But I will also say that maybe the biggest, unfortunately, maybe the biggest push that mental health awareness has gotten in this country has been the drug epidemic, because it is literally at people's door. It is their sons, it is their neighbors, it is their parents. It has affected a large portion of the society. And so everyone is aware and everyone's sort of talking about mental health, particularly in that context. But in terms of raising community awareness, the grassroots organization that I mentioned, the Mental Health Coalition in Sierra Leone, is an incredible organization. It's in seven different districts in the country. They're a nationwide program that was designed to build awareness for mental health. And they do that in a variety of ways. They hold annual conferences in different communities, both in the city and rural communities. They also work with the mental health nurses who are scattered around the country to bring awareness. And then I will also say that even though the doctors and nurses that are based in the hospital, they still do work in the community. So they have nurses and social workers from Sierra Leone Psychiatric Hospital that actually go into schools and go into homes to educate parents and teachers and students about some of the mental health issues that they may already see amongst their classmates. So yeah, there's a big push to bring awareness to the forefront, and the drug epidemic has made that even more of a priority for folks.
All right, we'll go ahead and end it there, and let's give our panelists one more round of applause. So we've reached our final item on the Washington Weekend agenda, which is wrap up and group photo. We'll get to the photo in a couple of minutes. But while I still have everyone's attention, I just wanted to take a few minutes to thank the entire team behind Washington Weekend, starting off with everyone today at the National Press Club who helped set up this room for us, helped with audio, visual, and the food and everything, kept everything running smoothly. Also, our campus partners and faculty partners who were able to join us throughout the weekend. I think some of them are still here, maybe, but thank you for making the time to be here, as well as our family members and friends of our reporting fellows and their loved ones who were able to join us today. It was great to welcome you to our presentations. Now on to Pulitzer Center, folks. First of all, thanking Natalie, Flora, Marina, John. I think they're all still here. Pulitzer team members who took time out of their weekend to come listen to all of your amazing presentations. Really appreciate your support. Next up being Ash, our IT extraordinaire, who I think is behind the column. Ash has done so much for this weekend. He kept all of your slides running smoothly. We had some frantic run-throughs before any of you arrived in the morning, and he helped make it all happen. So thank you, Ash. Next up being our photo and video team, Daniel, Grace, Phil, and Mark, who captured all of the amazing content this weekend. And don't worry, those videos and photos are coming soon. We will share all of them with you so you can share them with your friends. Next up being our social media team, Lucy, who is here with us somewhere. Yeah. Lucy has been posting on Instagram a lot. She also designed those beautiful bags that you all got, as well as, along with Grace, worked on this wiki site that we kept telling you to visit all throughout the weekend, as well as Alonzo and Sarah, who are not on site. They're out there in other parts of the world, but they are keeping tabs on Twitter and other social media stuff. Next, Alexandra, our amazing intern. She came from New York for the weekend to help us out and really had to jump into things on Thursday when you arrived. So thanks so much for everything, Alex. Next up being the campus consortium team of Anne, Michaela, and Ethan, who are all, I think, still here. I don't know if I can even summarize what all they did, because I feel like you guys were just jumping in on every random job that needed to be done, and it was very much appreciated. And then lastly, my reporting fellow teammates, Jazzy and Kem. Jazzy joined us full time, I feel like, as the planning of this event was really ramping up. And that is a very hard situation to jump right into. So thank you, Jazzy, for everything. And of course, Kem, thank you for just leading the vision of this weekend and for everything you do on our Reporting Fellow stories. All right, that's all I have to say. Oh, wait, no. Thank you to the Reporting Fellows. I even had it in a big box circled, so I don't know why I missed that. But But yeah, to the reporting fellows, you guys all had so much attention throughout the weekend. You had so much energy. You did amazing presentations. You met one another. You hopefully had a lot of fun and made really cool connections. And this doesn't have to be the end of those conversations and those connections. Keep them going via social media or in person, or however you want to connect. We also will maybe call on you guys for Pulitzer Center outreach opportunities, various alum gatherings that we have throughout the country. And also, there's always, future grants from the Pulitzer Center. A few of our fellows this year have had previous fellowships, and I know we heard from Jonathan and Julia throughout the weekend who have been reporting fellows in the past. So yeah, definitely stay in touch, and I hope you're all really proud of what you've accomplished, what you will continue to accomplish, and yeah, just everything you've done in this fellowship. Congratulations.
Thank you, Libby. And I just want to reiterate what Libby said, to stay connected and join our alum group. And I also want to tell you, I have learned so much from all of you this weekend and throughout the year. And I know I'll continue to learn a lot too, because you're not finished. But I just very much appreciate the excellent presentations you gave Friday, Saturday, and Sunday. And also, I think the questions have never been better. So thank you for participating in the Q&A on both sides, asking questions and answering questions. Really appreciate that. And I'll just say it again, I've learned a lot. And I hope that you've been inspired as well. If you haven't finished your project, you may now go out with a greater sense of what's coming next. And all of you, I'm sure, will do more presentations, more reporting, and I hope you'll be inspired by this weekend.